Hi there. So today I'm going to be talking about different considerations for ELL evaluation. So one of the first is the impact of dialect or differences in language on assessment. So how your dialect or a student's dialect will affect the way that the assessment goes and how it's completed. So when assessing a student who speaks another language or a different dialect, there are a few things that you take into consideration. Also, if it's just a small difference in the language. So different dialects have phonological differences and variations in morphology and syntax. So this comes into play when assessing them to see if there actually is a language disorder or if it's just that their dialect is affecting the way that they are answering. The dialect that the student has must be considered in the assessment of oral language. This is because if a tester does not realize that the student has a dialect, that they may wrongfully test the student and may answer certain things a different way because they think it's a dialect or they may think it's a language disorder. So dialect is not a language disorder, but may be confused as one if it's not recognized. Like I was saying before, if the tester does not know that the student has a dialect or speaks in a dialect, they may confuse it as a language disorder and may refer the student for different services when it's really just that they're speaking a different dialect. Continuing on with this, there are three errors that can occur if the dialect is not well understood. So the first thing is that professionals may assume that all students from diverse groups are normal dialect speakers. Second, professionals may overcompensate for the dialect and confuse actual disorders as dialect characteristics. So they may just think that, or they may think that because you're using a dialect that you have a language disorder because they don't realize that you have the dialect and it hasn't been clarified in the beginning of the testing. The third is that professionals may undercompensate for the dialect and assume that dialect characteristics are language disorders. So, I think I just got those two mixed up, but professionals, the overcompensating, so they're thinking that you don't have a disorder and it's just your dialect. And then undercompensating, they're assuming that it's just the dialect when they really could be missing a language disorder that there is. So there's many different things that can occur if they're not, if they haven't realized that the student has a dialect and what that dialect consists of and how it may affect the way that they speak. So there's different intervention options for English language learners. The most common one is bilingual education, and that's the one that's most widely used. So this is a program for students who are English language learners and are not yet proficient in English. There are a couple different components that go into this bilingual education, and one would be the L1 and content area instruction. The second would be cultural context, and lastly would be English language learning, so teaching the English language. Bilingual education really focuses on learning both languages because really you are probably going to be more proficient in life and later if you know both languages well. So if a student is identified as having a disability and is also an English language learner, they may receive both bilingual services and special education services. So there's different ways that this can look, and they would get bilingual. There may also be a bilingual special education program, but not all schools have this. So there are certain other options that they would have if this is not available at the school that they go to. So a few of the different ways that special ed and bilingual or ELL services can be combined is that there can be a special education classroom with a bilingual teacher. That's for all students. Or there can be a special education classroom with a bilingual aide that can help with those bilingual services as well as special education services. But they're integrated into that special education classroom so that they're receiving both sets of services. The last consideration would be that that teachers and professionals can over or under identify students for special education services. So I kind of describe this in the best way that I knew how to, and students who are culturally or linguistically diverse may either be over or under identified. So if a student is over identified, it's usually because their language or cultural differences. Teachers may think that since they have a language or a cultural difference, they must not be understanding what they're learning. And I've seen this happen a lot. You may think of students who have tested just because they do have that language difference or that cultural difference, that they have to get tested for I don't remember what the test is actually called, but every year that Spanish-speaking students have to take this test, and teachers may also assume that these students may need different services just because they're speaking a different language, but really they could be understanding everything in your class perfectly. Students may also be under-identified as well as over-identified, but if they're under-identified, it's usually because teachers assume that they're a little behind just because of their language or their cultural difference, and may miss that they're actually struggling academically. So they may think during English that because they're not getting everything right, it's just because their language is different or their culture is different, which really could be that they're not understanding at all and they really do need that extra help. So these are just a few of the considerations for ELL evaluation.